Hello, my name is Dennis Tomas. I currently work as a registered nurse in a mental health facility in Orange County. I received my BSN from the Inter-American University of Puerto Rico and have chosen to continue my education at Brandman University to become a doctorate level prepared nurse practitioner, specializing in psychiatric and mental health. My goal is to increase my scope of practice and contribute more to the quality of care my patients will receive. Since working in the field, I've noticed a significant number of individuals that are rehospitalized consistently for often the same reoccurring reason. It was this demographic that I wish to reduce through the research I will conduct in my scholarly project. The overall goal of my scholarly project is to implement innovation to increase medication compliance amongst individuals suffering from schizophrenia. The goals cannot be achieved without the support and collaboration of the stakeholders, like yourselves. You're all sitting here because you have a significant role in implementing change. We would have participating members from each local hospitals and have psychiatrists working with these patients. And I'd also like to thank the nursing staff of each for joining in this with us as well. Each of you have a direct hand in the care and outcome of these patients and see the daily results of noncompliance. Medication and treatment noncompliance among individuals diagnosed with schizophrenia is common and is a continuing dilemma that affects 50% of individuals in this demographic, as shown by Defee in a research study entitled "The Study of Reasons of Noncompliance of Psychiatric Treatment," published in Issues in Mental Health Nursing. This not only affects the individuals suffering from this disease, but from noncompliance also affects society by increasing criminal rates, elevation in healthcare costs, and deferment of supplemental state funds to mental health facilities or healthcare clinics. Recent and conservative estimates place the total number of taxpayer dollars spent treating the schizophrenic patients at 155 billion, uh, accumulated in a study called Global Economic Burden of Schizophrenics, a systemic review, published in the Neuropsychiatric Disease and Treatment. A recent study looking at violent crimes perpetrated by individuals suffering from schizophrenia found that those that were treated with antipsychotic pharmaceuticals were 45% less likely to be convicted of violent crime, shown in a study called Antipsychotics, Mood Stabilizers, and the Risk of Violent Crime, published in The Lancet by Dr. Fazell. My plan for innovation in medication compliance would be to begin with understanding our patients, their needs, and the spectrum of their knowledge on the disease. Surveys will be taken before the treatment plan has been initiated and every month following. The survey will present questions that will allow for all individuals involved to get a baseline for the patient's motivation and understanding of their treatment. This plan can only be achieved by the direct involvement of psychiatrists and their staff to implement treatment education, patient goals, and regular surveys of progress. The collaborative effort from the physician and their staff will ensure the best form of treatment is found and is understandable for everyone. The predicted outcome would aim to decrease the crime and recurring hospitalizations. While violent crime cannot be eliminated currently among persons with schizophrenia, compliance with these medications could result in a decrease of crimes, as proven earlier by the Dr. Fazell study, Antipsychotics, Mood Stabilizers, and the Risk of Violent Crime. Studies have shown that the occurrences of acute psychotic episodes and hospitalizations can be greatly reduced by adherence to treatment regimes, including medications, proven by a study published by Dr. Birnbaum, Medication Adherence in Schizophrenia, Patients' Perspectives, and the Clinical Utility, published in Patient Preferences and Adherence. It is our duty to come together to improve the lives of the patients we care for as stakeholders. You may see an increase at first in expenses to pay for a survey program. Psychiatrists and their staff will see a need to readjust the routine doctor appointment and consider implementing a new time management system to increase the amount of time spent with each patient for medication and treatment education. My plan also includes the use of mobile application called Scheduled for nursing staff to utilize as a tool to remind patients to take their medications and to come to scheduled appointments. A nursing theory was utilized to form a conceptual framework for goals and outcomes. It is necessary to evaluate the patient and their needs to solidify the direction of this project. The nursing theory I have chosen is a grand theory pioneered by Dorothea Orem. The premise of this theory is that patients wish to care for themselves, but are often deficient in ways to do so. An integral part of my project is to properly educate the patients on their conditions and treatment to institute a greater compliance. I do not believe that patients are stupid, but often ignorant of the symptoms and the overall benefit these medications can provide. I plan to institute the theory often throughout the study to assess deficits in care and remedy them when they arise. I appreciate you all taking time out of your day to watch this presentation and understand the goal I wish to achieve by pursuing this undertaking. I hope this presentation has given you a good understanding of the importance of medication compliance and the necessity for innovation.